Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode, I answered another question from one of my clients, James, and the question in the last episode was how to manage seizures in intensive care after a hemorrhagic stroke. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to continue answering the next questions regarding James and Christine's dad in ICU who's had a hemorrhagic stroke. James and Christine's dad had a brain decompression where they evacuated a large bleed from his brain after the hemorrhagic stroke. And their dad also underwent a craniectomy, which is basically a removal of the skull, to decrease the brain pressures after the bleed. James and his sister Christine were getting their dad in one of the best hospitals in the United States, the Cleveland Clinic in Ohio. In the meantime, their dad was getting a tracheostomy because he couldn't be weaned off the ventilator and the breathing tube. He also had ongoing seizures due to the stroke, and his anti-seizure medications needed to be optimized so he could wake up and progress to neurology rehabilitation. In today's episode of Your Questions Answered, I'm talking to James again about how he and his family should manage their dad's confusion, aphasia, which is basically the inability to speak, and his dad's disturbed breathing pattern. James wants to know what's the best course of action in how to get his dad more awake, how to manage his anti-seizure medications without being prone for seizures. So today's consulting and advocacy session is another excerpt from various one-on-one phone and email consulting and advocacy sessions with me. And the topic this week is part of this series of one-on-one consulting and advocacy sessions with me. And the topic this week is how to manage tracheostomy, confusion, and seizures in intensive care for your loved one after a stroke. You can also have a look at previous episodes of the one-on-one consulting and advocacy questions with James and Christine. Again, if you're clicking on the links below this video, and if you are watching this on YouTube, just scroll down, click on the link. That'll get you to our website where you can read this dialogue between James and myself in this one-on-one consulting and advocacy session. And you can also access previous episodes from this series of questions answered with my client James and his sister Christine. Also, look out for the next episode with James and Christine next week, where I continue to consult and advocate for their dad. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? Well, you get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. Or you can call me. Find international phone numbers on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the consulting tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.